everyone, it's Adrienne with Implant Practice Magazine, and we're here at AAID 2021, and I'm here with some Ditron dental pioneers, and I would first just like to chat with Dr. Ole Jensen here for a few minutes. Would that be okay?
Yeah.
Okay.
Happy to be here.
Thank you. Thank you. So congratulations. I understand that you just published an article in Jomi. So can you tell me a little bit about that article?
Right. Interestingly, it's an editorial with Jomi, and the title of it is "The Job to Be Done." The idea is that in implant dentistry, we haven't reached the point technologically that's optimal for patients. In other words, there's some more things that we need to do in order to help patients not become infected long-term with dental implants. So that was the subject of the article, and it has to do with some new technology that we're working on in our company.
Okay. And so I know that you've done a lot. You've done some pioneering in implant dentistry and also clear choice.
Mm-hmm.
And so tell me why Ditron? What was the reason behind that?
Well, of course, I have done a lot of stuff, including working with Clear Choice, but I wanted to, at this stage in my career, to contribute something that I think would help patients and dentistry at large, and that is to try and reduce the incidence of peri-implant disease, which we found longer term, 5 to 10 years out, we would see patients losing a lot of bone. Not all the patients, but some. And we found out in the literature that maybe up to 20% or more patients suffer from peri-implant disease by 10 years. And so that's an outstanding issue that we need to address, and that's what I decided to do with this new company.
With that said, where do you see implantology in the next few years and moving forward?
I think we're at an exciting time. People might think we're leveling off, but really I think we're going to have more and more implant dentistry done in the future. In the United States, we perhaps are half of the incidence of countries like Korea or Israel, in that patients are not seeking treatment for all kinds of different reasons where they could benefit from it. And so I believe that there's a great future for implant dentistry in the decades ahead.
Great. Thank you so much.
Yeah.
I'm also here with Dr. Robert Miller. How are you?
Good. How are you?
Good. And so thank you for joining us. I'm glad to have both
pleasure.
you guys in one place, and just wanted to see what your thoughts were on joining Ditron and why Ditron Dental right now in this place in your career.
I still have an active practice. I've been involved in oral implantology now for 35 years. And my office actually is quite the museum of past technologies.
Okay,
If you come, I actually have 21 dental implant systems in my practice.
Oh my goodness.
With
Tried them all.
Ditron being the 21st. I'm not a collector of dental implant systems.
Okay.
I am a very discerning clinician whose main focus is my clinical outcomes.
Okay.
And if I jump to another system, it's because I get a better clinical outcome with it. I've done it 21 times, but hopefully this will be the last. But it's not about revolutions anymore, it's about nuances. And the architecture, the way it's manufactured, the precision with which it's manufactured is actually giving us a better clinical outcome, both short and now longer term. I'm quite pleased with the outcomes that we're getting.
That's amazing. I know that you lecture all over. You practice within your own practice. So what advice would you give to a budding implantologist in this space? What would you tell someone that might be on the fence in trying Ditron implants?
Well, it's going to depend also on what their experience is. If they're a novice implantologist at the beginning of their training, the beautiful thing I like about this, which I haven't experienced in many years, is that it's a very intuitive system. The drill system, the way it's used, the linear progression of drills matched to the implant sizes that we have. In addition to that, the platforms are all the same size. so you don't have to carry this huge inventory.
Okay.
And you can't make a mistake. Whatever size of the emergence profile that you need, the attachment, the part that goes into the implant is the same size. So it simplifies their decision-making process. But at the same time, they're getting the benefit of advanced engineering and manufacturing, so they're going to be happy with their clinical outcomes.
Okay, so that's for a budding implantologist. So what about somebody who has something that they've just been very familiar with in their practice and they're comfortable? What would be your advice to them to maybe switch?
Well, that goes back to what Dr. Jensen was saying. And we've all been faced with peri-implantitis. And it's probably the fastest growing pandemic within our discipline. And one of the reasons for that is actually related to the macro architecture and the abutment mating system of these. The lower the micro leakage and the architecture of the way the implant sits within the bone can contribute to or prevent the occurrence of peri-implantitis. And my bone retention, my crestal bone retention, the lack of crestal bone loss, the security that I have when I attach my abutment systems and my prosthetics, I don't have the complications that I had with my previous systems. That's a plus for me as an experienced clinician.
That's amazing.
Can I answer that question also?
Absolutely.
You know, I have said provocative statements sometimes in lectures that I've given, such as this. From time to time, you have to abandon in clinical dentistry what works. I did that 5 times. I didn't do it 21 times, but 5 times in my career, I changed implant systems. They always were working, but there was some increment of improvement that was enough for me to change and abandon what works.
Right.
And now with the Ditron implant system, once again we have something that I think is worth moving on to.
Absolutely. Well, we will be publishing more information as time goes. Our winter issue will have more information. Our spring issue next year, stay tuned for that. We have our cover story that will have more information on the Ditron system as well. And I'm sure you can go to Ditron Dental, is it DitronDentalUSA.com? Or any of the social media platforms and to find out more information. And thank you so much for joining us, guys.
I'd like to get Dr. Miller's autograph.
Maybe it'll be both you on the cover.
Can you sign my...
I love it. Thank you so much, guys. I appreciate it.